I have boils, abscesses, and sores that won't go away. They hurt a lot. I remember this woman looking at me and saying, "That's disgusting. It's just unbearable. Things get very, very red, there's a lot of pus, and there are deep abscesses." In other words, she's a very bad case. A lot of people would run away as soon as they saw it. This program examines dermatological conditions and the processes involved with treating them. Because they are so violent, viewers should use their own judgment. I'm really looking forward to seeing Dr. Emma, because I think I've tried everything else. Yes, of course. Got an appointment to see Dr. Emma. A lot of the things I've tried have not worked for me. My name is Elise. I'm 25. I suffer with chronic boils, abscesses, and lesions that then pop. I get it under my arms, in my groins, my legs, my later bits, my belly, under my boobs. They hurt a lot. My own mother had it, I have it, and now Elise has it. So I do feel, it's my fault. Elisa's has been far worse than me. Under her arms is awful. This is my normal routine of a morning. Get up, clean my arms, other bandages on. Here, this is from yesterday. So it looks like a big sweat patch, but it's actually where my arms have drained. And it's all sticky and gunky and fluidy. Yesterday morning I woke up and it had all burst under my boobs. So I had to clean that up and put bandages on, and this one's on basically for pain, because when it's out and got the oxygen to it, it just is unbearable. It's just something you have to learn to live with. But it's really, really painful and exhausting. And the real pain feels like I can only describe it as someone with a hot, hot knife or a hot screwdriver screwing into you. If I go out walking, and it can just be a relaxed walk, within 20 minutes, half an hour, I'm limping, because there's a lump come up somewhere, or one that I didn't know was there, and I've aggravated it because I have been doing that extra walk. And then you fight with your weight, because I've ended up like taking comfort in food because you enjoy eating, and when you're eating, you're not thinking about the pain you're in. Yes, I think dating has been tough for at least, because most people would just run for the hills if they, took one look at it really. So yeah, it's been a hard time for her. I remember one time I was sat out in a pub yard, and there was me and my friends, and I had like a lump under my arm, and it burst, but I had an open top one. So and it was quite a big one, and it was draining, and I remember this woman, she just looked at me, and she was like, "That's disgusting." If Dr. Emma is able to do something for me, I feel like it will change my life dramatically. Hi, Elise. Hi, I'm Dr. Emma. You want to come with me? Just follow my clippy, droopy heels, my tap dancing shoes. So Elise, can you tell me a little bit about what you've come with today? So I've come with a skin condition, called hidradenitis suppurativa. How long have you had this for? Probably since I was about 8-10, like when it first started to form. I was quite young, and then gradually it's just got worse and worse over the years. Why people get it, we really don't know. It does affect about 1% of the population. That's a lot of people. Hidradenitis suppurativa is a chronic, so a long-term skin disease, and it's very inflammatory. So things get very, very inflamed, and it causes death really of the follicles. There is a lot of pus associated with it, and deep sores. There I've done a bit of extra walking, and I can already feel in my groin a sore bit. Okay, I'm forever having to clean my arms, and like they always stink. Like I'm always having to try and wash them and use antibiotic lotions, and that's the only thing that really helps me with the smell. But it's hurting work now. I know that in the next couple of years, if I let it get much worse, that I won't actually, because I'm a hairdresser. And how's it affecting your work, do you think? Well, I can't really lift my arms up. I'll move back and forward, but that's about my range. So I've just had to learn to adapt. And do you do that because you don't like the idea that the scars are there? Or the pain? Because of the pain. Because of the pain. I think that's what a lot of people don't understand from a skin condition like this. That pain is debilitating. Yes. They want to have a look at your skin if that's okay. And just get a feel of the gravity of it. You can put your head back against the pillow, and then I'll move the bed up a bit so you're not lying down quite so much. I'll fold you in half. Yes. So, this is really, really quite inflammatory disease that you have. These ones here look like they've been open for a long time. Yes, they've probably been open 2 or 3 years, okay, and they've never really healed over. No, never. It's so toxic it's not allowing them to heal. Yes, you've got these tubes that are formed. A tract is where we see something on the outside, but it's almost like a tube going deeper down into the skin. And at all of those points within that tunnel is whenever the infection can then successfully set up, and that's whenever you end up getting an infective problem on top of your inflammatory problem. And then you have the scars obviously linked with the old lesions. Can I have a look at the other side now? Okay. And that is so painful that feels like it's on a nerve. Every time I move my arm, it makes me like jump out the chair. You can see the normal skin in between it. But then you've got these boils either side. Ely has been through all of the conventional forms of treatment, antibiotics, the topical treatments that normally people will use. She's also had surgery in the past to try and remove the skin in this area, and that broke down, and the disease recurred around it. So, she's a very extreme case because you've tried all other kinds of medicines to date. You really fit into the group of somebody who would be able to do well probably on a drug, and that's a biological treatment. Your sickness has to be at a certain level of severity before you should be offered it. It's not something for everybody. These drugs, they're very clever. They work just in one part of the root of inflammation, and stop that. These are molecule-based drug treatments. It does carry risk. It can increase your risk of getting an A cancer. It can cause problems within your own defenses. And it just worries me like the side effects of it really. With any drug at all, there's possible side effects. But in most cases, people tolerate it incredibly well. And for many people it can be quite life-changing actually, the effect that this medicine can have. Yes, it's about trying to weigh up and understand what the risk is truly for you. And the benefit that you could possibly have from being on a treatment like this. What do you think of that? Yeah, I'm willing to try anything now, I think. Well, to an extent, 'cause you get to the stage where actually I'm like, I have to do something about this now. Yes. So we'll get everything set so that we can start on this. We have to set up a different appointment with your blood test and things like that, just to make sure that everything's all okay, and then start on the medicine. Yes. And you'll have really good help the whole way through it. You'll have a nurse that you'll be able to be in touch with. All of your blood tests are all going to be kept an eye on. You'll have dates to see us. Yes. Thank you, Jacob. I'm feeling excited now. I'm feeling ready to start some treatment and see what happens. Hopefully, it means that I've got a better quality of life in the future if these treatments work. Feeling positive. It's been about 8 weeks since I started my treatment. I showed really good signs at the start. And it's kind of fluctuated up and down between good and bad days, but I'm still feeling positive about it. Hi, Elise. Hello. Yes. How you doing? Good, thank you. Good to see you. How are you? Good. Come with me. Good. Come and have a seat up on the bed, Elise. So nice to see you. And you. You gave me a call this week because you'd had a cyst that had come up that burst, is that right? On the base of my spine. Was healed last time I came, and then it burst open on Saturday and just went everywhere. Okay, I was like, no. That's not a loss or anything. I know that you might think that it is. This is early days kind of in the starting of this medicine. Just have a good lick. Is that okay? Yeah, this one. Okay, good. Okay, so I'm going to have a little press on this if that's okay. Yeah, there's a wee bit of discharging from that sinus, but actually, there's still a big drop in the actual lesion count. Can I have a look at the ones that were on the side now? Is that okay? 'Cause, this was this one that was quite big actually whenever we very first met. That looks much better, so there's really good. Okay, so I think generally from day one, starting the medicine, things are looking much better. Loads better. Good. And, in terms of the dressings and stuff, is at the beginning you were in pain all the time. You're having to wear dressings every day. Thinking about just those factors, what's the change in that now? Pretty much everything. I barely put patches on now. It's rare that I have to put a dressing on to have my hands handled. It would mean the total world to me. It would mean I'd be able to go back to doing normal simple things. I could stay in my job, just be a normal 24-year-old, living her life. Hi, Abby. Hello, hi, nice to meet you. I'm Dr. Emma. Come with me. Thank you. This hoodie is great. I'm looking at it filled with these so much. Just hop yourself up on the bed, here facing me. What have you come along with today? So the past couple of years I've had this really dry, scaly skin on my hands. Been to the back and forth to the doctors, and I've had different explanations. Contact dermatitis or fungal infection. What do you do for a job? I'm a veterinary nurse. What an exciting job. Yeah, it's exciting, it's busy. And it started on which hand first of all? It started on this hand, and then spread onto this one and it's gone up here, and now it's on this foot. Well, I'd quite like to have a look at your skin now, if that's okay. I'll let you pop that mask on. I'm going to pop this one on and then if you're okay to take off your gloves and your shoes and socks. Yes. Brilliant. Okay. Oh dear. Oh you poor wee thing. This looks really sore. It looks like a lot of these pustules have done their popping. And it's now just very dry and scaly and swollen. Why? Okay, and then you've got the same thing over here. The whole bottom of the foot is fine. Okie dokie. You've got these changes on the palms of your hands, and one of the things that we always have to think about, could this be an infection that's caused it? And the commonest type of infection, especially in somebody who works as a veterinary nurse, is could this be a fungal infection? And, I've seen people who have worked with animals who have picked up funguses from a hedgehog or a dog. Once it starts to be on the other hand, and on the foot, I have to say being a fungal illness is probably further down my list. And we have to think, could it be something that's affecting the skin, or is this an inflammatory condition of something like palmar plantar pustulosis? Palmar plantar pustulosis is a chronic inflammatory condition of the skin, or something inside the body is causing that inflammation, and you see it only on the hands and the soles of the feet. Can you think yourself of any event a couple of years ago that might have caused this? Was there a rise of stress in your life? Probably stress. I went through a breakup and then my tests were happening which I wasn't doing very well at. Interestingly, one of the things that can set this off is stress, and I think that that's probably been the case for you. But what we can do is now that it's been started is find out a way of how to control it. I'm going to improve the topical type of treatments that you're having on the skin. But I do need to make sure that there isn't a funny fungus infection that you might have picked up at your place of work. So we'll take some scrapings of that today. Okay, fungal infections we'll usually see on one hand, but this is both of her hands. She's got a little bit on her feet. So that's why this is much more likely to be palmar plantar pustulosis rather than fungus. But the trouble is, if I treat her for palmar plantar pustulosis and don't rule out a fungus, and there's fungus there, well then that would just get a whole lot worse. Maudie and Rosie, this is Abby. Hi, do you mind to get me a banana blade and a black envelope? Thank you. We tend to try and take it from the edge. Is it a bit tickly? Feels very nice. Don't try this at home. So, I am just taking off the dead skin cells here. If there's any fungus in this, you can see it under the microscope, as long little kind of like strings of spaghetti. And now, I'm just going to take a little test. Yes. So taking the scrapings and taking the swab just helps us to identify any little critter that might be living on your skin. Okay, I'm giving Abigail some washes for her hands, some creams to start to build up the skin barrier, and some creams to settle the inflammation that's there. Thank you so much. And then once I've got this scraping result back, then I'll decide what our next plan of action is. I'm so pleased that I've come to see Dr. Emma today. She's been absolutely great. She's been really, really helpful. So I just got to wait back for some test results, and hopefully some treatment soon. It's been 2 months since I've seen Dr. Emma, and my hands are so much better than they were to begin with, and my life is so much better now. When I looked at my hands before, it made me cringe, and it felt so painful. And it just made me feel really, really nervous about myself. But obviously, when I'm looking at them now, I can see that they are healing, which is amazing. Down. I think my biggest relief out of all of this is knowing that my job and my career working with animals isn't what's causing this condition, because I can continue to do my job, which I love. Abigail was distant, really, really stressed, and she didn't deserve it. It's nice being able to feel their fur. Like I know that's so small, but it's nice. No more. You can have one more. Seeing Abigail so happy, actually it makes my heart melt. It's just amazing just to see her how she's changed. I want her to be happy in her life, and not be held back because she's got a disease. I think Dr. Emma has totally changed my life. I can just be a normal girl now, and I'm so thankful. I can just do the little things like brushing my hair, brushing my teeth, because holding the toothbrush was painful, cutting up my dinner, walking the dogs. So that's great. Done. I am here to see Dr. Emma. If that Emma could fix him and get him better, it would just change our lives. No one so far has been able to help. So, if Dr. Emma could possibly identify me and give treatment, I'll be ecstatic. Hi. Is it Aldrin? Hi. Hi, I'm Dr. Emma. Do you want to come with me? Tell me what's brought you along today. Basically, I'll get these lumps or boils that form under my skin, and sometimes they can break through with pus or blood. Oh no, the very first one I was on my side, that went away 'cause I popped it. Of course. Yes, but that's the only relief I can get. But ever since then, it's just got more and more violent. But the main areas that really worry me is my armpits and my bum cheeks. What is this like when it's at its worst? It's just I can't bear the pain. Like spend days in bed, run down or stressed outside of work. I stopped going to gym, and I don't take my boy out as much. So yeah. Oh, that sounds pretty awful. So it does. And you've not had a diagnosis. Nobody's no. I was labeled. Okay, well I'll need to have a look at everything so that I can give you the official diagnosis and then hopefully come up with a plan that's going to start making things a bit easier. I hope so too. Let's look at the shoulders first. Yes, of course. You know, so you can see how angry the skin's been for quite some time. But you've described them as boils, and that's kind of pretty correct. That's what they are. Deep-rooted cysts. So whenever you squeeze these, bits of pus might come out of it. Yeah, it does. Like it gets really big, and it starts to leak. Leak, which are the clue as to, what's going on really. Already I know that this is something called hidradenitis suppurativa. Okay. Oh yeah, all over, aren't they? And these are deep as well. You can feel the boils underneath. Hidradenitis suppurativa is a condition where certain follicles within the body, usually in the groin, buttocks, or the armpits, become blocked. And the products that are inside the follicles, they break down and start to cause an immune reaction. And you get lots of inflammation, and it usually presents as boils and abscesses, and it can cause lots of scarring. This is what your normal skin looks like. It's perfect. And normally the buttock skin is even more perfect, because it's just protected all the time. But it's much, much, much darker, telling me how much inflammation has happened here. Okay, Aldrin, I'll let you get back into your clothes now. Hidradenitis suppurativa is actually a common condition. Probably about 1% of the population might have this. It's also a condition that not too many people talk about, and because they don't talk about it often, it doesn't get diagnosed for some time. It is heavily associated with people who have anxiety and depression because it's such a burden essentially to carry around all the time, and usually it's built into your genetics. We can't change that, but we can control it enough that it doesn't bother you in your day-to-day life. That's like the most I'm looking for. That would be good enough. So I'll give you some creams just to kind of help out with the skin. And these are very painful whenever they get inflamed. So we need immediate pain relief that can kind of help you cope. And then I would quite like to put you on a medication to try and switch the process off for the pain point of view, and also so that you can go, right, okay, I can stop being so tired, I can do the things that I want to do, 100%. So we've got a plan and we're on your side through this journey. The best news literally, and to know that there's steps to be taken to go forward towards it. Not good to leave this and not treat it. It's going to repeatedly keep going through this cycle where new follicles will start to become inflamed. This is having a huge impact on Aldrin's life. It's intensely painful. It's also really knocked his self-esteem. He's somebody who wants to go to the gym and play with his kid, but he can't really do all of those things. To have your skin really hold you back in that way, it's quite upsetting. I was feeling a bit more excited. Dr. Emma definitely knew what I had. She diagnosed me, and she's starting a treatment plan for me, and I have hope and faith that I will get better. I'm here to see Dr. Emma today because it's my first checkup since I started the medication. To have someone listen to me and knowing what I have, it's made me feel better. I'm feeling positive, and hopefully she'll see the results. Hi, Aldrin. You all right? You all right? Yes, come with me. Yes, and you look quite different when I saw you last time. Tell me then, how are you feeling now? From when I first came in, obviously I feel a lot better. Good. I was depressed, grumpy, I had a bad attitude. I barely played with my son. I wasn't going to work, couldn't go to the gym. Now everything is like 10 times better. I can sleep comfortably, I can walk properly, I go training, I go and work, constantly playing with my son. That's the best part about it. I tend to get a flare-up or two, but the pain is just so much better. So much better. Well, we're on the journey. Okay, can I have a little look? Is that okay? Yes, grand. Okay, let's have a look. Is that all right? Yeah, I guess so. Again, okay, have a peek. What a difference. This is great, isn't it? These ones here have all gone flat now. Brilliant. Okay, let's have a look here. Now this side is amazing. Your skin looks lovely. No, there's nothing new at all here. That's so good. Okay, so now I want to have a look at the buttocks. Is that okay? Right. Again, this is really nice and flat. It's a lot smoother, isn't it? It's much smoother. Very good. These ones now have all cleared, which is good. But this one and this one are a bit active. They're so sore. So why don't I inject those ones? Go on, this day, yes. Okay. So it's just a little steroid injection, don't you worry. That will help to switch off the pain and inflammation a bit more quickly. Okay, so you'll just feel a wee tiny scratch, and a wee tiny push. Wee tiny push. There we go. Done. And a wee tiny scratch. Very good. That's great. Well done. All done. You are made of tough stuff. Okay, Aldrin. And with the medicines that you're taking and the creams, hopefully we'll get all of this completely clear for you.